The topic for the video is Simultaneous Estimation Method by HPLC, Challenges and the Remedies. Many of the formulations require simultaneous estimation of the components. You might have heard regarding the combination formulations or the fixed dose combinations. These are called as FDC. Whenever there are the fixed dose combinations or combination formulations required to be tested, that time generally the simultaneous estimation method is developed, because this method will be less time consuming and it will be cost effective. So simultaneous estimation methods are developed by the HPLC. But there are certain challenges in the simultaneous estimation method by HPLC. So we will see the challenges and the solutions. First challenge is selection of common detection wavelength. If the formulation contains 2 or more APIs or drug substances, that time detection becomes very important. Each analyte may have different UV absorbance maxima, that is lambda max. So choosing a single wavelength that provides good sensitivity and selectivity for all the analyte is difficult. Solution for this problem is selecting the suitable detector, use of DAD or compromise at an isobastic point is the solution. Diode array detector can be used to have the detection of multiple components. There might be other solutions to this problem. Differences in chemical properties of the analyte, variation in the polarity, variation or differences in the pKa, differences in solubility and stability may affect retention and the separation of the components. One analyte may be retained for more time or less time than the another one. So this may lead to poor resolution or separation. This is the challenge. Solution is to optimize the mobile phase composition, selecting suitable pH and selecting suitable column is the solution to this problem of differences in chemical properties. Third one is peak overlap and resolution. Coelution or partial overlap of the peaks makes quantification inaccurate. Solution is use of gradient illusion or change in stationary phases. So column can be selected which is more suitable. Gradient illusion can be used. Always we need to understand the column chemistry to get the solution. Matrix interference. Excipients in the formulations or biological matrix components can lead to interference. Solution is adequate sample preparation and use of the internal standards. You can use different composition placebos to understand the interference. Then fifth one is different concentration ranges. So as fixed dose combination formulation contain one analyte may be at higher range or higher dose, another at lower or minimum dose. So this will lead to differences in the concentration range. One analyte may be present in much higher concentration than the other one. Difficult to detect both accurately due to detector saturation or poor signal to noise ratio. You might have come across the formulations for antidiabetic range. So metformin is generally around 1000 mg, while the other component or other API in that formulation, in that fixed dose formulation may be 5 mg, 10 mg, 2.5 mg or 1 mg. So this difference in the concentration range is the problem. Solution is use appropriate dilution or dual calibration curves. That means proper dilution to be selected, or you can go with different calibration curves for the different APIs. Sixth one is mobile phase compatibility. Mobile phase should be compatible with all analytes and it should not degrade the column performance. Solution is buffer selection and pH optimization for the compatibility problem. Linearity and validation across range. Ensuring linearity, precision and accuracy for both drugs across different ranges. Solution is robust method validation covering the full range of both analytes. 8.1 is method robustness and reproducibility. So minor changes in the method performance or performance parameters like flow rate, pH may impact the separation. Solution is perform method robustness studies as per ICH Q2R2 guidelines. We need to understand the analyte, we need to understand the method parameters, we need to understand the effect of analyte onto the method parameter. Then only we can find the solution. Ninth one is stability of analytes. Analyte may degrade in solution, particularly due to the effect of light, heat, pH or oxidation. Solution is conduct forced degradation and solution stability study to understand the degradation mechanisms and to come with the solution to prevent this. Regulatory requirements, meeting system suitability, specificity and validation parameters for multi-analyte method is stringent. Solution is to follow ICH and other regulatory guidelines completely so that regulatory problems will not be challenging. This is the short information and understanding about the simultaneous estimation method by HPLC. Thank you for watching the video and I request you to please do like, share and subscribe to this channel. Thank you once again.